Good morning. Let's see if I can get this. So what we'll do, we'll kind of have you guys over there, just to stay distanced. All right, and we'll get ready. Danielle, just checking. Sound okay for folks? Okay, good morning. And happy Easter to everyone, and of course, snowy Easter, as often actually happens here. We get this surprise snowstorm, and for us came the day after Easter, which was actually really good timing for a number of reasons. So I hope everyone enjoyed the weekend, despite all the distancing and so forth. I know that Easter's a time of renewal. It's a time of rejuvenation and rebirth, and in many ways, what a strong message for what we're going through as a community, and of course as a country and as a state and so forth, but also with the weather helping. And so because in many ways, hopefully, the weather was so cold and windy, and now today, of course, with it snowing, this is great for social distancing. So I think it was a good message, both from weather and, of course, for Easter yesterday, and wonderful for my kids, too. I know all of us, at least working with children at home more often and stuff, Easter was a welcome break from the routine, and very exciting. My kids are young enough, they had all sorts of questions about the Easter Bunny that I'd never gotten before as a dad, so it was pretty cool to go through those. Now, we do want to talk about what's going on with respect to everything at our city and around central New Mexico. We do have a number of items to cover today, but we're going to focus on how we're trying to keep our police department safe and our first responders. And so we are going to hear from our chief of police as well as one of our deputy chiefs on this topic. And we'll touch a little bit on enforcement as well, but those are our deep dive topics for today. And let me begin by also thanking every business that has closed, and despite the financial hardships and so forth, is in it, all in this together, whether you're a business or you're a customer, either getting takeout or making takeout or staying away from your business because it's not essential. So I want to thank everyone for cooperating in general in a great way over the weekend. Now, there were some exceptions, we'll talk about a few of those, but by and large, not many. And so it was a very good weekend with respect to what we're trying to go through. Now, I also want to mention that we're continuing to fight crime, so we're going to talk a little bit about that today as well, and the notion that we are, again, as APD, we are very focused on fighting crime, and of course, we've got to do certain things with respect to enforcement of the health orders and so forth, but that is a far cry from our everyday vigilance when it comes to crime. Now, a few other things to mention with respect to enforcement. I think we're up to total complaints to about 273. We've done 420 levels of education and only 2 citations. We did have one more over the weekend, and so that's a good thing. And again, a reflection of the fact that we're taking this seriously, but our priority is fighting crime in the Duke City. Now, complaints, as a reminder from folks that are taken from 242 cops, from 311, and from the fire marshal's office and the state police, and we work together on doing that. And again, we have our field team, our field operations team from APD doing their normal field work and responding to calls. We do have a couple of folks who take some shifts on enforcement of public health orders, but other than that, we just respond to complaints. Open space this weekend was busy despite the weather, but in general, people did a good job social distancing, really appreciate that. And we had a couple of educational conversations from our open space APD department and our open space parks team. And we did have a couple of citations, but nothing major at all. We did respond to 3 search and rescue calls. So as a reminder, this is normal for this time of year, but also something we had to do again this weekend. So in general, actually, it was a pretty stable weekend, all things considered, in Albuquerque, and so I want to thank everyone for that. Now, a couple of announcements from around central New Mexico to share with you. First, Presbyterians testing site at the Balloon Fiesta is on hold today because of weather, and if you look outside, you can tell why. So with the snow and so forth, that particular location is on hold. Folks can still call the DOH hotline for information. And Optum's 3 sites, they are up and running. That's at the General Center Urgent Care, Tramway, location and the Rio Rancho location. Reminder from APS, our meal distributions that are happening in our community, they're now going to be reduced to 3 days per week starting today. So you'll be able to pick up lunches for 2 days, and they'll last for that time period. And then again, so Monday, Wednesday, Friday, and you can get 2 days worth of meals. Also, as a reminder, our Wi-Fi program is up and running today to correspond with online education starting today. I know my daughter was starting today for the first time that more formalized program from APS. And again, our Wi-Fi locations, our drive-up Wi-Fi locations are up and running. And again, ccabq.gov, our website, or call 311 for details on that. The Health and Human Services Department from the state is distributing enhanced payments of SNAP food stamps for households that did not receive the maximum SNAP benefits in the months of March and April. So reach out to the State Human Services Department webpage for more information on that. Also, applications are now available for the State of New Mexico's emergency loan program. This is through Sun Mountain Capital. You can visit their website, sunmountaincapital.com, for the application process and details on that. A couple of reminders also. Want to remind everyone to try and drive slow through residential neighborhoods. We have gotten a lot of calls about just residential speeding, whether it's folks trying to rush to and fro, food store, etc., or just driving around town, because that's kind of a lot of people are doing right now. The issue is, of course, more children are playing outside, and so I want to remind everyone to just please pay attention to the speed limit and especially drive slow through our residential neighborhoods. Also, a reminder to complete the census. It only takes 10 minutes. It's snowing outside. It's a great time to fill out that census form and get it in for us. Right now, New Mexico is unfortunately ranking quite low on the census rankings. Bernalillo County, by the way, is doing much better relative to the rest of the state, so just appreciate everyone in Bernalillo County, but we want to remind that we're actually all in this together as a state, as a lot of the programs come to the state, so we need the whole state to do that, as well as Bernalillo County to overperform, to help out some of the other areas in our state. Okay, with that, let's get into our specific topic for today. Actually, before I do that, one other announcement. Just want to remind folks, today's the first day of our emergency early child care program that we talked about on Friday. But we want to remind folks that we do have limited option for child care of all ages. And again, we've been doing this since Corona started, again, just for public health workers, essential workers, first responders, etc. And that's all ages. That's happening at almost every community center in the city and has been. That's still available. There are a few spots left. Again, only for emergency usage only. Check out cabq.gov for details on that. Okay. Now, we want to talk a little bit about what we're doing at our police department with respect to protecting our personnel, our officers, from COVID-19. And just like before Corona, our officers are out in our community, of course, every day. And as a reminder, it's the largest police department in 1,000 square miles. So our police force has to deal with everything that comes with being a regional urban capital, and that is even more so in the time of Corona. And so I want to remind everyone that our officers continue to aggressively fight crime. In fact, over the weekend, we're continuing our Metro 15 program. We were able to get another person off the Metro 15 program. This was the 35th offender arrested since we started this law enforcement strategy. This individual was actually hiding in a hotel room, and we eventually found him and is now arrested. And we're also continuing to hire more officers. So our program, both lateral officers and frontline beginning officers, those programs are very much up and running, and it continues to be a high priority for us. So is keeping our officers safe. And we know that in other cities, New York, Detroit, New Orleans, officers coming down with Corona has been a major, major problem. It has crippled police departments in parts of the country. And we also know that this is a big reason why some cities are looking at curfews. Curfews really seem to be put in place mostly because of law enforcement shortages because of Corona. So we do not have that challenge at this time, and we're trying to prevent it. But of course, we're aware of that, and we're thinking through what happens if we need to do that. But part of the best thing we can do is protect our officers so that we don't have to do that. So We're limiting exposures to our officers as best that we can, whether it's the safety glasses, gloves, 2 types of masks, and hand sanitizer that have been issued to all of them. We're using the medical approved processes for reuse of masks and working with our city warehouse staff to do that. We're also proactively keeping officers away from coworkers to stop community spread. So Chief will talk about this, but a lot of our staffing is meant to contain spread, because I think the unfortunate thing is at some point this is probably going to happen. Some of our officers, some of our first responders are going to come down with corona. And the key is that we're able to contain that spread. And so that's what we're setting up now, and that's unfortunately what a lot of these other departments did not have in place in advance. Hopefully in our department, because we're setting this up, we'll be able to contain that spread when inevitably it probably will happen. Now, more on that in a minute. I do want to mention too that we're doing our rapid testing protocol. So whenever folks are exposed, we have them tested right away, again, to contain folks who test positive. Right now we have no positive cases, but again, we expect positive cases. It's pretty much inevitable for our frontline workers. And so we're talking about how to best protect the rest of our officers that are out there. So I know this is something a lot of us in our community are facing, whether it's our healthcare workers or our early childhood teachers or our grocers. But again, because of the nature and the way our officers have to respond, and of course also our paramedics, which we had an update on last week, we know that they're truly on the front line, and by definition, they are in the wake of corona right now, and so we're doing the best we can to protect them. So with more on that, let's begin with our Chief of Police, Mike Geyer. Chief?
Good morning. As the mayor said, I'm really happy to report none of our officers have COVID. And it's because of a lot of the resources we've learned from other departments, lessons learned. We have weekly conference calls with the Major City Chiefs Association, and everybody across the nation has the same concerns. So we followed some of their best practices, and actually Deputy Chief Smathers will briefly touch on some of the things that we've acquired from learning, talking to these agencies. We have done to date 111 assessments of APD personnel. That's both sworn and civilian. What an assessment is somebody inevitably is going to be exposed possibly on the job with a suspect, and maybe with a coworker that develops symptoms, or just a family member or any other person they come in contact with. If anybody actually displays those symptoms or complains about that or has been that exposure, is we do a quick evaluation. We have one central point with a lieutenant that handles all those intaking calls from supervisors, and we just make that determination. Generally, what we do is we isolate them for a couple of days to see if they get symptoms. If the person that they were exposed to develops the COVID and determined that's a positive test, then we'll require a test from them as well. So it's a layered process, but a lot of officers are pulled off the street for a few days at a time. I think it was last week we had a squad of officers, I think 3 or 4, that were exposed to another coworker who possibly had a contact from a family member. We isolated them. Fortunately, it was over their weekend, which was 3 days. They were tested in the interim and came back to work the following week with again, they weren't tested positive. So again, this is an ongoing process. We have 5 officers currently on what's called a PEM status. This is the payroll status for somebody that is sick but has related to COVID. They're not necessarily sick in this case, as they're in that isolation stage where we keep them away from everybody else. They stay on that status until we get the test results, and then they go back to normal duty at the end of that. This changes all the time. It was 5 this morning, it went to 4, and then it's back up to 5 just in a matter of a couple hours, so you can see how dynamic this actually is. Again, we know also we have to adapt in case we do, with this anticipated possibly spikes or raising in the curve, we may lose more officers to this. And so we have a plan that we've learned to develop a staffing system, a 3-tier staffing system to deal with this. It basically provides officers on deck to backfill any of these shifts or squads or units that are depleted because of this assessment process. So in order to maintain those service levels, the first tier, we've developed up to 135 officers and 35 supervisors that can be pulled without impacting any of the investigative units. So we're talking mostly the traffic unit, the motors unit, DWI, our problem response teams, horses, those units of that nature that basically have secondary functions but can be called to service as officers to backfill those positions. Our second tier is where there's an additional 39 officers and 6 supervisors available. Now we start tapping into some of the investigative units, up to 50% possibly could be pulled for that purpose. If fully implemented, that utilization of Tier 2 and Tier 1 would provide 173 officers and 41 additional supervisors, again, to backfill. The last tier, which we hope, again, won't happen, but if it does, it utilizes both Tier 1 and Tier 2, additional 215 officers, 55 supervisors. It's going to significantly impact all but the most critical investigative units, so homicide, child abuse, sex crimes, things of that nature, violent crimes, won't be impacted as much as some of the other units. Again, now we'll have a total of up to 388 officers and 95 supervisors available, should we ever reach that critical mass situation with the disease. It also gives us flexibility to rapidly respond, because this process is in place, so it's activated when needed, and we call it out, and it'll meet also internal and external needs quickly without depleting the field services. That's the uniformed officers, and they're out there every day. So an example is, I mentioned the one with the other officers, but suppose that 8 officers from one particular area command are placed on this self-isolation due to an exposure. Tier 1 personnel would then be called in to do the backfill for that squads during that time they were gone, and that area command would have these backfilled officers available to take calls for service and respond to other police calls. So then we maintain that shift, and again, as long as it needs, we keep that in place. As the mayor mentioned, we are putting our officers at great risk. You've seen stories again, some of the arrests that they're making. I mean, these people, they have to go close contact with. We encourage them to wear their mask and the protective gear, but sometimes it's not always possible, and we've had a few exposures where they've unknowingly walked into situations. But for the most part, we give them that information. A lot of resources weekly. We put out weekly video information, not only to reassure the officers, but to give them information to protect them and their families. We had an offender this weekend. They tracked down a sex offender who was known to keep rifles and body armor in his house, so it was a high-risk call. We've had a couple of SWAT calls this weekend as well, all taken into custody without incident. And this just goes to show the need that we need our officers, and they are out there doing their jobs. So we do want to continue doing everything we can to protect them and ensure that APD can meet all the challenges that are presented by this particular pandemic. I don't know if you want to go back and let Mike say a word.
Yeah.
Okay, we'll put the mayor back on. Thank you.
Thanks, Chief. So next, I just want to introduce one of our deputy chiefs, Mike Smathers, and he, we try and, in general, of course, promote from within our police department, but now and then we like to poach some really good talent. He does come with an accent, so be ready for that. But Deputy Chief Mike Smathers has been heading this up for us. DC?
Good morning, everybody. And just to expound briefly on what the chief and the mayor have said, we have a really robust process in place for the men and women of the Albuquerque Police Department. If they are exposed in a contact, either they don't happen to be able to put on their protective equipment like the chief mentioned, or there's some other factor, we assess them immediately 24 hours a day, and then we make a determination. And if they've had a high-risk exposure, we separate them and allow them to be away from their families. We put some of our employees up in hotels just to add added protection for their families or themselves, and then we hopefully are able to rapidly get a test back for them and then bring them back into service. And so that is an ongoing cycle of exposure, testing, and response back to work. We utilize the tiered staffing that Chief Geyer mentioned to backfill any needs. So from the public's perception, you would never notice it. It would be seamless. We might lose a couple of people for an assessment. We backfill them appropriately and keep our service levels at the same. We keep our service levels the same for that. So that has been working very well for us. The chief mentioned we are taking best practices from departments across the country. We've stolen some ideas from them, and this is an accumulation of some of our own internal work as well as what we've seen other departments do to be successful in that effort. So I'm very comfortable and want to assure the people of Albuquerque that we do have a good system in place that will hopefully allow us to maintain all of our service levels for hopefully we don't have a case of COVID-19, but we're prepared if we do, and I believe we'll be able to maintain all of our service levels.
Thank you so much, Chief and Deputy Chief, and again, grateful to have you both and for your public service today. And Deputy Chief Smathers comes to us from Charlottesville, Mecklenburg County Police Department, and has, interestingly, a little bit of a background in emergency operations and so forth, and so here helping us out just at the right time. So we are going to move to questions here in just a moment, and again, the Chief and Deputy Chief are here for questions as well. Let me wrap up by mentioning a couple things. Continues to snow, by the way. We are getting a lot of questions about the road conditions and so forth. At least in the city proper, the snow doesn't seem to be sticking. We do have our DMD teams on standby. A reminder that Tramway is usually a county road or a state road, so we're working with folks, east of Tramway and sort of what the situation is up there. But we're treating it like any other snowing situation, and the good news is it's not sticking much, so folks will be deployed accordingly based on what's happening. And so with that, let me talk about some ways to help. These gentlemen here, to help them and our officers out, we are asking for donations to the APD Chaplains Fund. This is a fund that is used for all sorts of purposes, but has also received some wonderfully generous donations just over the last 2 weeks. And you can do that by calling 768-2131. And again, that's APD Chaplains Fund. If you want to do that online, you can go to the onealbuquerquefund.org, and just in the memo or comment section, just note that you'd like your money to go to the Chaplains Fund. Okay, our myth-busting item for today is really just talking about, look, something that's come up over the weekend, and then as more and more people come down with corona, is this notion of stigmatizing individuals in two categories. One is if somebody does come down with coronavirus, obviously these are people who need care and attention. And so in whatever way is possible, and there's lots of stuff online about how to do this, especially for family members, now is the time for care and compassion, as well as trying to not have that spread. But we do know that a lot of the folks who seem to be passing away, if they didn't have inherent conditions, it's because of a support network that isn't quite as strong. And again, there's a lot of national media covering stuff like this, but I just want to touch on it locally, that each one of these cases, they're individuals and they're loved ones, and they're people that also need our help. Now, relatedly, at grocery stores or at work or at home, we know tensions are running a little bit high. And we also know that, there's this, if somebody coughs or rubs their eyes or sneezes, that, everyone seems to be very paranoid about that. And look, we understand that. That's very natural. We also know it's allergy season, and we also know that there's lots of different things that are going around anyway. So we want to make sure that people follow the protocols by the Department of Health, but also that we are patient with each other and smile to each other and say good morning and good afternoon and so forth, and remind each other that even if they're wearing a face mask or not wearing a face mask, we're glad to see each other, even if it's 6 or greater feet apart. So with that, we just again ask for your patience and your true Albuquerque, one Albuquerque spirit with respect to inclusion, diversity, and resilience. These are all part of what makes us who we are and what makes us a very special city. So with that, takeout over the weekend was La Mexicana, and excellent. And let's take your questions. So Jesse, anyone in the room first?
Any in-person questions today?
I have a few. So these are from TJ on the hotspots that the city is pushing out. So they're saying that APS says it has 18,000 kids without internet. Do you think the city's initiative can help that many kids get online?
So the question is just about the drive-up Wi-Fi that we're providing, and I think as a city we're trying to step up as best we can, and so this is literally a donation to APS, but for our kids, of the Wi-Fi spots that we can afford and put up. And again, right now I think we started with 10, we're expecting 40 by the end of the week. We have plans for 80 different drive-up hotspots, so that should make a difference in a lot of folks' lives with respect to the ones that are not connected. The other ones, hopefully, whether it's Comcast program or others, they'll get help too, but we're just all trying to step up in the best way we can, and this is a very big way Albuquerque, city of Albuquerque, is stepping up for our kids.
Do you guys have any estimates about how many people you think the city can get online in a day?
The question is about sort of our estimates on our online capacity in a day. We do have estimates for that. What I would actually do is check with the Department of Technology on the exact ones. I don't have those off the top of my head, other than, again, those number of eventually 80 hotspots. And so we'll follow up with you through Jesse on those details.
We don't have any on Zoom, so if there are any more.
So in regards to protecting police, and I know you guys got a few suspects, almost 15 on one suspect. This also come after the woman on Thursday that was allegedly spitting and kicking on at officers near the art bus as well. Did this come as far as protecting them? Is that the reason this is being amplified?
So the question is about a specific incident with respect to some challenges we were having with just an individual in the public, possibly mental illness situation. And is this connected to that? It's actually not at all. So I think that is unfortunately something that happens in Albuquerque every day for our first responders. And this program that we put together, I think was about 2 weeks ago, we were on a call with law enforcement, and I know the chief was bringing up, hey, we've got to get ahead of what's happening for our department because of what we're seeing on the East Coast. And simultaneously, I was on a call with mayors, and they were like, you've got to get ahead of this. And we said, let's put together a plan that borrows the best practices that we can. And our team did a phenomenal job within about 3 days of putting this plan together. And it's actually been ready and in effect since early last week. But now we fine-tuned it and are sharing it with folks. Anything else you want to add on either of those?
No, sir. I mean, we've had this in place for quite a few days.
Go ahead.
Our employees have the appropriate PPE or personal protective equipment, and they're always encouraged to wear it if possible. And then sometimes we might put a mask or other protective equipment on a person that we are dealing with as well to protect them and to prevent community spread. So it's been in place for well before the incident that you referenced.
So basically, because of everything that's going on the East Coast with officers and COVID-19, you guys are just amping this up to continue to protect officers here.
Correct. We're trying to be very proactive related to an exposure, and we separate them, get everyone tested that's appropriate, and then we don't bring them back until we've gotten a clean bill of health either from that employee or the person that they had contact with, just to minimize community spread within the police department.
Other questions?
I just got one in from Nancy about just an update on the status of the Loveless and Army Field Hospitals.
Questions about an update on the status of the Loveless and Army hospitals. The DOH is quarterbacking that at this point, so I think they would have the most up-to-date information. We don't have anything different than what we shared on Friday, but we do know Loveless, of course, is on target, and we're working with them on that sort of the permitting, the certifications, which is really the easy part. And so far, we have no hang-ups or hiccups with that at all.
I think that's it.
All right, okay. Well, with that, wish everyone the best on this snow day, and it's a great day to stay home. Take care. We'll see you tomorrow.